All right, so here we go. Hello. Just a quick review of the chest anatomy that we went over a few weeks ago, last week, whatever it is, depends when you're looking at this video. This is just a quick review of the chest, and then I'm going to mainly focus on the abdomen. All right, so we got the heart right here, obviously. It's a nice shot of the left ventricle right here. This is the left atrium, the most posterior chamber. This up here is the right ventricle. That is the most anterior ventricle chamber. And you have the right atrium right here. Know those chambers. The left and right ventricle are separated by the interventricular septum. You need to know that. Obviously, this is the descending aorta. If I go to the arch, this is your aortic arch right here. You know this is the aortic arch when it's the most superior portion in the lungs. You start to see you're getting into the apices of the lungs there. If I was to go more inferior, this is called the arch because underneath the arch, you have your right pulmonary artery that goes underneath it, like a car going under a bridge, feeding deoxygenated blood to the lungs for oxygenation. This is your pulmonary trunk right here, coming from the right ventricle. And then this right here, this is your left pulmonary artery going to the left side of the lungs. Those are all structures you need to know. Interesting thing, what you also need to know is this here. This is a nice shot of the azygous vein. This is the alternate route if the vena cavas are obstructed for blood flow. So let's go ahead and follow this. It's supposed to empty into the vena cava. In this case, I'm going superior, so you're going to see this empty into the superior vena cava. So let's follow this. Going up. It's going to take a curve and it kind of arches, so I have to go a little slightly inferior now. And that's where it meets the superior vena cava right here. And the superior vena cava, go more inferior, meets and becomes the right atrium. Okay, so that's pretty cool. Just know those structures. I'm going to start from the lungs. Okay, so now in the abdomen, right side, the first structure you meet after the diaphragm is the liver. This is the entire structure of the liver. All this right here. This patient kind of moved a little bit, maybe due to respirations. You have this kind of hazy look here. There's some motion. But you can see the vessels in the lungs here. It's not clearly defined, although this patient did receive, as you can see, this IV contrast. Just know inferior to the liver, another important structure is this dark density structure right here. This is the gallbladder here. So I'm not going to show you axial CTs of the liver and gallbladder. I'm going to show you diagrams. Just know that inferior is to the liver is the gallbladder. You're going to have to know the different ducts that empty into the duodenum. So you got to know the cystic duct, the common hepatic duct, the common bile duct, and where those empty out into the duodenum. Those empty out bile via the sphincter of Oddi. That's a good question I could ask you. Other structures here, if I was to go back up from the lungs, here's your diaphragm here. First structure you see usually on the left side is the stomach. And this large structure here is the stomach. So this patient may have just drank some fluids, ate some food, and this is dilated, and it's a very large stomach actually. Right behind the stomach is this structure here. It's a little bit lighter in density, so that tells me that the structure is a little bit more dense than the fluid of the food in the stomach. This is the spleen right here, posterior to the stomach. Let's look for the pancreas now. If you see the spleen, usually anterior to the spleen is the pancreas, the tail of the pancreas. You can kind of see this structure right here. I was to follow this. This structure right here is the pancreas. It runs from the left side and it goes towards the middle of the abdomen. If you notice, it kind of has this caterpillar type look to it. That's how you know that this is the pancreas. This is going inferior, and this is superior portion of that pancreas there. The coronal images, I'm going to scroll right there. You start to see the kidneys. This is your left kidney right here, the right kidney. And this corresponds to here on the axial images. This is the right kidney. This is the left kidney right here. So far we've gone over the liver, gallbladder, stomach, spleen right here, the pancreas, gone over the kidneys. This is obviously the descending aorta. And I'm going to stop right here. Around the descending aorta, you kind of look and see that there's this kind of these lines right here that run on both sides. It almost looks like a wig on top of the descending aorta. This is part of the diaphragm. This is called, well, plural term for that is crura, and on one side, or singular, would be crus. That would be a good test question to ask you for the exam. Surrounding or underneath this little wig, you find the descending aorta as well as the vertebral spine. And I can also change windows on this axial cut or slices. So this is now a bone window. You notice these little white structures right here. These are the ribs. So if I was to go more inferior to the lumbar spine, you see that they start to disappear. They're gone. Once I'm going now superior, and we're going to find where T12 is, where the first rib or where the 12th rib meets. So take a look at this rib right here. See where it articulates. This one now. There, that's T12 now. This is T12, the first rib. As I go more superior, now that's T11, where the other rib meets at the posterior, or the right and left posterior articulation. So T11, I'm going back down. This is T12, rib, posterior articulations. And this next one should be L1 with no rib branching off of it. See, now there's no rib anymore. Now you're officially in the lumbar spine. You can confirm that on the coronal images. You can still see the kidneys on the, even though this is a bone window to descending aorta. What I noticed in this patient, if I go more inferiorly, this patient had surgery. You can see these screw placements going through the pedicle. There's one there, joined by this rod, and there's the other screw right there. And then this little density here is looks like a prosthesis that was input into the disc space to increase the height of the lumbar spine due to whatever pain that the patient may have. I'm going to switch back to a abdomen window here. Okay. So other structures, you see all these bowel loops right here. This is all bowel. The one that runs most anterior, this is your transverse colon right here. I'm going to go more inferior. You start to see the crest of the pelvis. Here is your ACIS right here, where we typically palpate. You notice that this is the descending aorta. It has calcifications there. If I go more inferior, it bifurcates into the left and right iliac arteries that feeds the vessels of the legs. Another structure I want to go over with you is on either side of the spine, you have the psoas muscle right here. This is the psoas on the left, this is the psoas on the right. And if we were to follow this, we're inferior. It's kind of hard to see because there's streaking in the CT. This actually goes down and attaches to the lesser trochanter right here. This helps you raise and lower your legs. That's what the main function of that muscle is. Obviously, this is a male patient. You have the pubic symphysis here. I'm going more superior. It's kind of hard to see, but this is the bladder in here. And you start to see that there are these densities, white densities in here. These are phlebolyths. This is the rectum right here. Your coccyx bone back here. Gluteal muscles back here. More bowel. So these are the main structures that you would see in the abdomen. Kidneys, liver right here. The stomach, very large stomach filled with food, fluid. Gallbladder. If I was to follow this aorta down, you start to see the different arteries that branch off of it. So here's one artery here. Let's follow this, see where this goes. This curves this way. Curves around. This feeds the liver. That is the hepatic artery. This artery here Let's follow this. This looks like it's going towards the kidney. That is your renal artery. So I'm going to start from the top, and I'm going to slowly go down so that you can kind of look through these images on your own. I'm still trying to figure out how I can upload these images without giving a date or the location of where this exam was done. Obviously, I want to keep this anonymous. So I'm going to scroll down so you can look at your own time. You can pause the video whenever you want. Okay, it's going inferior, and then I'm going to stop at the pubic symphysis, and I'm going to go back up. These white structures up here are just leads on the patient. You can see the streaking that this causes right here. So know all these structures: liver, gallbladder, stomach, spleen, pancreas, kidneys, descending aorta, bifurcation, iliac arteries. I'm going to let you know exactly in class what you need to know. Hopefully this helps, and you can view this at any time that you want. I plan to do this more often so it'll help you guys out, get used to looking at the axial images, coronal images, so on and so forth. Okay. If you have any questions, just email me or inbox me. We can go over this together at another time, but just let me know.